Hi there, YouTube family. Welcome to Dr. G Pediatrics. In today's video, I am going to give 5 things that a caregiver or parent can do after their child is diagnosed with autism spectrum disorder. Stay tuned for more. So, your little one has been diagnosed with autism spectrum disorder, and there can be a lot of different emotions that you feel or the people around me feel after that diagnosis. And sometimes parents may not know what to do. So I want to highlight 5 things that I think parents and caregivers can do after their child has been diagnosed with autism spectrum disorder. Number 1 is love your child. I know it sounds corny, it sounds cheesy, but it's true. Love your child. No matter what the label is, no matter what the diagnosis is, no matter what the prognosis is, love your child and love your child unconditionally, and your child is going to be able to feel that and understand that no matter what the diagnosis is. So, seems like an obvious one, but it's something worth being said. Number 2, early intervention therapies. So if your toddler has been diagnosed with autism spectrum disorder, they may be delayed in more than one arena. The top things that we look at is speech delay, gross motor delay, fine motor delay, and social delay. Your child or toddler may not have all of those delays, but if they have any of those delays, they definitely should be involved in speech therapy, physical therapy, occupational therapy, and then ABA therapy, which is applied behavioral analysis therapy. So that is super important for whatever child that may have a developmental delay. The earlier that they can get those interventional therapies, a lot of times the better the prognosis or the advancements that they can make. Because remember, your little one's toddler's brain is still forming and molding. So the better we can do for them is with early interventional therapy. Number 3, ask for resources. If you don't know, you're not sure, that's where speaking to your child's pediatrician, or if they were diagnosed by a psychologist or a developmental behavioral pediatrician, whomever did the diagnosis, you just seek those resources because sometimes it can be overwhelming. You may live in an area where they actually have a autism center where there may be many different types of interventions that are done at that center. They may have nutrition support for children with autism spectrum disorder. They may have psychologists, psychiatrists. There may be feeding therapy. So seek those resources. You may not be familiar with what's available for your child, so do what you can do by just asking for any available resources that can help your child and you through this journey. Number 4, rally support. Not every family may understand what you're going through. Not every family member may understand what you're going through. Sometimes there may be differences within the parents and how they're going to navigate this for their toddler or child. And so I think having a support system is very helpful. There may be autism spectrum disorder support groups in your areas for parents managing having a child with autism spectrum disorder, or there may be support groups for siblings of patients or for people who have autism spectrum disorder. So you may not be able to get your support from family members and friends. If you do, that's wonderful because it takes a village to raise a child. But in case you don't have that within your own family, find support in other ways. There may be that available for you to help you navigate the journey. Number 5, which I think is important as a pediatrician for sure, are staying on top of those well child checks. As I referenced in an earlier video, the 18-month checkup, the 24-month checkup, the 2.5-year-old checkup, those are checkups where we are assessing that developmental progress for a toddler. And so your toddler may be somewhere along that timeline diagnosed with autism spectrum disorder. So circling back home to your medical home which is your pediatrician's office, is important, because your pediatrician can help you navigate finding those resources or support. Your pediatrician can then assess how your toddler is advancing if they're in therapies, and to be able to assess, okay, this is what, she's doing now, like this is the improvement that we've made, or this is the area where I'm still saying, let's make sure that we're getting the most therapy as we can to help facilitate her growth and development. Or there may be times where your pediatrician may say, there are other things that I see that I'm thinking that maybe we should look into some, genetic reasons, or getting some blood work drawn to see if there is a medical reason that's associated with autism spectrum disorder. Fragile X syndrome is one of those genetic disorders that we see that association with autism spectrum disorder. Usually those toddlers and children may have some other physical characteristics and attributes that may prompt us to actually go ahead and do some blood work to assess for that. So again, 5 things that you can do for your child after a diagnosis of autism spectrum disorder is love them, get them involved into early interventional therapies, ask for resources, rally support, and stay on top of those well child visits for your little one. I hope you found this video helpful. If you did, please subscribe and share it to someone else that you may think may find beneficial. Until next time, have an awesome day and stay great. Bye.